Hello viewers, let's see about subchorionic bleeding. A subchorionic bleeding is also called as subchorionic hemorrhage or haematoma. A subchorionic bleeding is the accumulation of blood between the uterine lining and the chorion. What is chorion? Chorion is the outer fetal membrane which is present next to the uterus. So this subchorionic bleeding can cause light to heavy bleeding or spotting. So around 1% of all pregnancies have a subchorionic bleeding, and it tends to be more prevalent among women who got pregnancy through IVF. A subchorionic hematoma can shrink in size and resolve on its own without any treatment. It rarely causes some serious health complications. So let's see how common is a subchorionic hematoma. Subchorionic hematoma are most common in people who are between 10 to 20 weeks pregnant. It accounts for approximately 10% of all vaginal bleeding. Most hematomas are not a cause for concern because they are small and they can cause light bleeding. So what causes a subchorionic hematoma? A subchorionic hematoma occurs when the chorion membrane detaches from the wall of uterus. The chorion membrane is the outermost layer of amniotic sac. The amniotic sac is where baby develops in the uterus. So this detachment from the uterine wall can be small or large. Who is at risk? Means high risk for the subchorionic hematoma. Here we can see several factors. Several factors have been associated with a subchorionic hematoma. Some of these factors include having the uterine irregularities, means having any abnormalities in the structure of uterus, having the history of uterine infections, history of uterine trauma, history of miscarriages, means abortions, and IVF pregnancy, and the pregnant ladies who are suffering with the high blood pressure. Let's see the complications of this subchorionic hematoma. Subchorionic hematoma may increase the chances of pregnancy complications. Some of the possible complications are excess vaginal bleeding, miscarriage, preterm delivery, placental abruption. How is this subchorionic hematoma treated? Many subchorionic hematomas will heal on their own over time. Some possible treatments for subchorionic hematomas are reduction in activities like exercise and lifting heavy objects, taking complete bed rest, follow-up ultrasounds to assess the size of hematoma, monitoring of symptoms that suggest early labor like contractions and cramping. The final one is hospitalization. So this is all about the subchorionic bleeding.